Every year, millions of Americans rely on Medicare Advantage plans to provide affordable and flexible healthcare coverage. But as we move toward 2026, things are shifting, and not just a little. Major reforms, cost adjustments, and structural changes are coming that could reshape how millions of seniors access and pay for care. So today, we're breaking down what's really changing in Medicare Advantage for 2026, and how it might affect your coverage, your costs, and your choices in the future. Before we dive deeper, let me know in the comments, what's your age and what state are you in? I love to see who's planning smarter out there and how these changes might affect you personally. Now, let's get into it. The Medicare landscape has always evolved, but 2026 is shaping up to be one of the most significant years for Medicare Advantage in the last decade. The reason? Several policy updates, cost control measures, and drug pricing reforms that will directly impact how Medicare Advantage plans operate, how much they cost, and even what benefits they can offer. One of the biggest upcoming shifts is tied to Medicare's drug price negotiation program. Beginning in 2026, the government will start negotiating the prices of certain high-cost prescription drugs directly with pharmaceutical companies. While this was first announced under the Inflation Reduction Act, 2026 is the first year we'll actually see it in action. The goal is simple: reduce the cost of prescription medications for Medicare beneficiaries. But what does that mean for Medicare Advantage? Since most Advantage plans include Part D prescription coverage, this change could bring lower out-of-pocket drug costs for many seniors. However, experts also point out that these savings might not appear immediately in your premiums. It might take a few years before insurers adjust pricing to reflect the government's negotiated drug costs. The Medicare Part D redesign will also take full effect in 2026. For years, seniors faced the so-called donut hole, where drug costs skyrocketed after a certain spending threshold. That's being phased out entirely. Under the new system, there will be a $2,000 annual out-of-pocket cap for prescription drugs, a game changer for anyone on expensive medications. If you're finding this information helpful, make sure to subscribe to our channel. We share important Medicare updates and guides every week. Now, let's talk about something that's making a lot of people nervous: the funding and payment structure of Medicare Advantage plans. In 2025, the Centers for Medicare and Medicaid Services, CMS, announced a series of payment rate adjustments that will officially take effect for 2026. These changes mean insurers might receive smaller reimbursement increases than they expected. While CMS says the adjustments are meant to control overspending and improve accuracy, some insurance companies warn that this could result in fewer extra benefits being offered in certain plans. That means you might start seeing Medicare Advantage plans scale back on perks like gym memberships, over-the-counter allowances, or expanded dental and vision coverage, especially in markets where competition is fierce. On the other hand, some plans are shifting focus to chronic condition management and preventive care benefits, investing more in long-term health outcomes than short-term perks. Another major shift for 2026 is the continued crackdown on deceptive marketing. Over the past few years, CMS has received thousands of complaints from beneficiaries who felt misled by advertisements or aggressive brokers. Starting in 2026, new rules will require all Medicare Advantage marketing materials to clearly outline coverage details and out-of-pocket costs. Call centers and agents will face stricter oversight, and every sales call must now be recorded and retained for 10 years. These reforms aim to protect consumers and ensure transparency in plan comparisons. We're also seeing a growing debate over provider networks. Many Medicare Advantage plans use narrow networks to control costs, but that can limit access to preferred doctors or hospitals. In 2026, CMS will tighten rules to ensure beneficiaries have adequate access to local providers, especially in rural areas. This could mean new contracts between insurers and healthcare systems, potentially expanding your provider options in some regions. At the same time, Medicare Advantage plans will face more pressure to prove they're delivering value-based care. The government is pushing for quality over quantity, rewarding plans that keep patients healthier rather than just delivering more services. This might lead to performance-based bonuses for high-quality plans, which could be good news for members enrolled in top-rated options. Now, let's talk about something that's often overlooked: premium and cost trends. While 2026 could bring modest increases in monthly premiums, these will likely vary depending on where you live and which plan you choose. Some insurers are expected to maintain $0 premium options to stay competitive, but others might introduce small monthly fees to offset the new payment structure. The average out-of-pocket maximum, currently around $8,300, may also inch higher in some plans. Still, with the Part D $2,000 cap coming into play, overall healthcare expenses could stabilize for many seniors, especially those managing chronic conditions that require ongoing medication. Another important change to keep in mind is how Medicare Advantage is being integrated with newer technologies. 2026 will see broader adoption of telehealth benefits, remote patient monitoring, and AI-assisted care coordination. These features became more common during the pandemic and have now become essential parts of modern healthcare delivery. Plans offering strong telehealth options might stand out even more next year, especially for seniors who prefer virtual care. Meanwhile, CMS Star Ratings, the system that measures the quality of each Medicare Advantage plan, will see recalibrations in 2026. This means some plans that used to hold a 5-star rating might drop, while others could improve if they meet new benchmarks. These ratings matter because they directly influence plan funding and bonuses, and they help consumers compare quality before enrolling. If you're finding this breakdown useful so far, don't forget to hit that subscribe button. It's the best way to stay informed as we cover these evolving Medicare updates every week. Let's also discuss one of the most impactful trends for the future: the growth of Medicare Advantage enrollment itself. Nearly 33 million Americans are currently enrolled in Medicare Advantage, and that number is projected to surpass 35 million by 2026. That means more than half of all Medicare beneficiaries will be in Advantage plans. This growth brings both opportunities and challenges: on one hand, more choice and competition; on the other, more complexity for consumers trying to compare plans. As enrollment expands, policymakers are keeping a close eye on cost efficiency. Medicare Advantage plans have faced criticism for being more expensive for taxpayers compared to traditional Medicare. In response, the government is tightening how risk adjustments are calculated. In simple terms, that means insurers will be paid more accurately based on members' actual health needs, not just projections. This is designed to curb overpayments and ensure the system remains sustainable long-term. Another interesting development for 2026 is the shift in supplemental benefits, things like transportation assistance, meal delivery, and home modifications. CMS is encouraging plans to prioritize benefits that genuinely improve health outcomes instead of flashy add-ons. So, expect to see more benefits targeting chronic illnesses, mobility support, and preventive care. We're also seeing more emphasis on mental health and substance use treatment coverage. The 2026 regulations will require better access to behavioral health specialists, ensuring parity with physical health services. This marks a big step toward comprehensive, whole-person healthcare within Medicare Advantage. For those approaching retirement or considering switching plans, all these changes highlight one important takeaway: comparison shopping will matter more than ever. Plan details are changing, and benefits that worked well for you last year might not be the same next year. Always review your annual notice of change, compare coverage for your prescriptions, and check whether your doctors remain in-network. By the time we hit 2026, Medicare Advantage will look more modern, more data-driven, and more closely regulated than ever before. These reforms aim to make the system fairer, more transparent, and better aligned with patient outcomes, but like any major shift, there will be growing pains. Some beneficiaries might lose certain benefits or face slight cost increases, while others could save significantly due to new drug caps and improved coverage options. The key is staying informed and adapting early. If you found this topic helpful, we've covered other related Medicare updates you'll see at the end of this video. Watch those next for deeper insights.